Hello, I'm Dr. James Jarvis, a family physician, and for the last 3 years I have served as the lead clinical physician for Northern Light Health's response to the COVID-19 pandemic. Over that time, I have had the pleasure and honor of speaking with many of you in person and many more through our media outlets. We have discussed things such as the symptoms of COVID-19, including the tragic consequences that many of our families still deal with to this day, the ways that we can keep ourselves and our family members safe, the importance of vaccination, its development, its safety, and its implementation. And of course, we have discussed how masking can help deter the spread of this virus. We have learned much, not just about this virus, but all respiratory viruses. Now, in response to the current community and hospital levels of individuals infected with COVID-19, the high vaccination rate, including bivalent boosters in Maine, especially in high-risk populations, the availability of treatments for those who are infected with COVID-19, and the current level of understanding regarding the transmission of respiratory viruses in general, we have reached a new phase in the pandemic. Following discussions with experts across Northern Light Health and across the state of Maine, and under the guidance of the federal CDC's recommendation for infection control, starting Thursday, April 20th, Northern Light Health will switch from a universal masking policy to a policy where masking is optional for anyone who chooses to do so within any of our facilities. There will still be times when masking is required, such as for an individual who has symptoms of a respiratory infection, a particular clinic or hospital unit where a large percentage of the population is at risk for severe disease, or when clinical situations warrant such measures. We ask that everyone continue to respect anyone who chooses to continue to mask, or if at the local level the decision is made to return to universal masking. We know that many of you will be excited with this decision. We also know that there are those that this decision will cause them to be anxious or have concern. We want you to understand that this decision was made with the best clinical evidence available to us in relationship to the amount of community spread across all counties in the state of Maine. Anyone who wishes to continue to mask will be treated with respect and dignity. If any individual requests that their care team mask during a clinical interaction, we will honor and respect that decision. We have been through a lot together, and we will get through this transition together as well. Northern Light Health is proud of the role it played during the last 3 years in keeping our families, our communities, and the state of Maine safe. Furthermore, we will continue to follow the science as we make decisions around safety, putting the care of our patients at the forefront of those decisions. We thank you for your continued understanding, respect, and support of one another as we move towards the future.